I have one last follow-up question.
Okay.
What influence, if any, did psychoanalytic ideas about the therapeutic relationship have on your ideas about the therapeutic relationship in cognitive therapy?
Well, you know, psychoanalysis has gone through many trends, and when some of the audience may have learned about psychoanalysis, it may be more updated or modern or more reasonable. But when I was in psychoanalysis, the therapist was a blank screen. The therapist was not allowed to show, in this case I had a woman analyst, she wasn't allowed to show her personality at all. And the idea was that the patient then would project his own impulses onto this blank screen. And once it gets projected, then the analyst could help along by making interpretations. So I would say that what I do now is just the diametric opposite. I try to confront, I try to approach the patient as an authority, somebody who's a specialist in this area, but as the equal of the patient, as a fellow traveler. We're traveling again together across a very bumpy road in many cases, and I'm kind of the guide. I've been there before, but I'm not superior to the person. That's quite the opposite of what the old-fashioned psychoanalyst is. Old-fashioned psychoanalyst was superior in every way, knew everything, and could peer into things that were invisible to other eyes, and he could ferret out what's there. So I would say my current approach, as it has evolved, is being as a kind of partner, but perhaps the more specialist partner in this particular area. My patients might be more successful as professors or as business people or as artists or even as homemakers, but the only thing that I have to offer then is my own specialty.
And I think one of the evolutions of cognitive therapy has been, in terms of the therapeutic relationship, has been working with patients with personality disorders.
Right.
And then I think it looks a little bit more like psychoanalytic or psychodynamic therapy, where we sometimes need to elicit patients' negative reactions if they have them toward us, the therapist, and then help them evaluate those ideas, because those ideas frequently then reflect the same ideas they have about other people outside of the therapy session.
Yeah. Well, that's something to use Freud's phrase, something he called the repetition compulsion. So the idea is the personality disordered individual replicates in the therapeutic session the type of problems that he or she had in growing up, and starts to react to the therapist just as he or she reacted to somebody in the past. So I think that's quite correct. And that is a psychoanalytic theorem, and for that I bow my head.
And then what we might do with that material was probably different from what an old-fashioned psychoanalyst might have done.
Yes, and so what we do is we would get the person to reality test that in various ways. But what's important is if the PD, personality disorder, the PD patient is reacting towards you in this way, this is probably causing problems in their everyday life. And so it's very important then to help them to work it out in the everyday life, not just to work it out with you so that you get along as nice buddies. But the thing is, it has to carry over, and the transfer over to other people in other situations is really critical. And the personality disorder patient, the PD patient, may never mention anything about his wife or colleagues or whatever, so you have to ferret that information out.